So there's a lot of different thoughts. So when you're looking at how do you maximise the outcome of therapy, there are a lot of different, I guess, mechanisms that may be discussed. The patient will bring a number of those to the table. Some of those may be complementary or alternative treatments. I think they need to be put in perspective. We do know that keeping active, so exercise at any phase of the disease, is likely to improve outcomes, certainly tolerance, and also being receptive to what is called palliative care and symptom control. We know active symptom control will also improve outcome in combination often with systemic therapy. So what is palliative care? It's a very important question, because people often, when you start to talk about referral to palliative care, they get one single thought in their mind, and the classic one is, I guess, the later stages of disease, potentially hospice type care. But that's very much a small part of what palliative care does. I mean, their main focus really is on maximising symptom control and with that quality of life. And they often will work together with the medical oncology team or the cancer team to try to maximise that symptom control. And we know that there is an improvement in survival by doing that, by having what's termed active palliative care. So it's symptom control, social supports often, and then later stage, I guess, that end of life care. So the lifestyle recommendations for refractory colorectal cancer, I think, again, may well be quite individualised, remembering that this is a group of patients who now their treatment options are becoming somewhat limited. So you don't want to be, in my view, too restrictive in terms of advice. And again, the patients will come with their own thoughts. So some will look at dietary changes, they'll look at various things that they feel will help their outcome. In a way, perhaps more freedom is a potential, because you are wanting to look at quality of life. So people who have restricted things, for example, you may have a discussion about perhaps, being a little bit looser in terms of those restrictions. But again, coming back to the point around exercise, so keeping active, keeping your mobility and exercise to the limit that you can do is highly likely to improve your overall outlook. Yeah. So often in terms of if we're talking about patients who are now in that advanced setting, patients and their relatives will have often already sought quite a lot of information. And so they will already have sort of, I think, networks, it's fair to say. I mean, there are a number of websites. I mean, for example, our website, the GICI website, the Gastrointestinal Institute website, is a very good resource. It talks about clinical trials, it talks about various patient-related aspects of care. So I think that's an obvious recommendation, but there are a number of those websites out there. Obviously, their oncologist is a good source of information around medication and other resources. But I don't think there's necessarily any specific area for the patient group that we're discussing. I mean, the difficult questions that patients in this setting ask when they become, if you like, refractory, they will vary, and there's a number of difficult questions. I mean, the ultimate one, of course, is, because you start to talk about, well, this might be your final treatment. You then, I guess, time. What is my time? I guess the other question that then starts to come out sometimes is, well, what's going to happen? What is the process of not responding to therapy? But then there are other difficult things like, well, what should I talk to my children about for younger patients, for example? So there are a number of different difficult questions, if you like, depending on the patient. Yeah. So why is AGITG or the Institute's work important? Well, in the setting of refractory colorectal cancer, of course, I mean, the group looks to seek out clinical trials that are relevant and accessible to patients in that group. I mean, overall for colorectal cancer or GI cancer, obviously, it does relate to clinical trials, access to new drugs, and then, of course, the Institute talks to patient information, advocacy to a degree, to hopefully translate the trial outcomes into actual drug access for patients and improvement in patient outcomes and what follows from that. So it's primarily focusing on clinical trials, but it's then the access and the improvements in patient care which I guess follows.